Have you ever had a headache from stress? Or back pain during tough times in your life? What if I told you that pain wasn't just in your body, but in your mind, too? This isn't just a gut feeling. Science says the connection between your mental health and physical pain is real. In fact, what you're feeling emotionally can literally hurt you physically. Stay with me, because you're going to understand why your mind and body are more connected than you ever imagined. Introduction to the concept. Asterisk. Pain is not just a physical sensation. It's an experience created by your brain, shaped by your emotions, your history, and your state of mind. Think of your brain like a control center. When you feel emotional stress, anxiety, depression, trauma, your brain doesn't just sit with those feelings. It sends signals to your body. That's why people with depression often feel 1. Chronic fatigue, 2. Back pain, 3. Joint stiffness, 4. Headaches, 5. Digestive issues. These aren't random symptoms. They're your body's response to your mental state. Science behind the connection. So, what's actually happening inside? When you're stressed or anxious, your brain triggers the fight or flight response. This releases stress hormones like 1. Cortisol, 2. Adrenaline. While these chemicals help you survive danger, too much of them over time causes 1. Muscle tension, 2. Inflammation, and 3. Weakened immune function, 4. Increased pain sensitivity. This is why emotional stress can manifest as physical pain. Doctors call this somatization when psychological distress is expressed through physical symptoms. Real-life example, Sarah's story. Meet Sarah. She's 35, works in marketing, and has struggled with anxiety for years. Over time, she started getting 1. Daily migraines, 2. Neck and shoulder pain, 3. Digestive issues. She went from doctor to doctor, neurologists, gastroenterologists, physiotherapists. No one found anything wrong. Eventually, her therapist asked, "Have you considered that your pain might be connected to your mental health?" Sarah started therapy, learned stress reduction techniques, and gradually, her physical pain began to improve. Her pain wasn't all in her head, but it did start there. Statistics and research. Let's talk numbers, because this problem is way more common than you think. Up to 60% of people with depression report physical pain. Chronic pain sufferers are 3x more likely to have an anxiety or mood disorder. According to the American Psychological Association, mental distress significantly increases the risk of developing chronic illnesses. And here's something powerful. Painkillers may help the body, but unless the mind is treated, the pain often returns. Some studies even show that antidepressants can reduce physical pain, not because they're numbing you, but because they're treating the root of it. Pain is personal, the brain's role. Pain isn't just about what's wrong physically. It's about how your brain interprets those signals. Two people can have the same injury, but one might feel intense pain, while the other barely notices. Why? Because the brain filters pain through 1. Mood, 2. Past trauma, 3. Stress levels, 4. Sleep quality. When you're anxious or depressed, your brain amplifies pain signals. It's like turning up the volume on a radio station. What was once a whisper becomes a scream. This is known as central sensitization, where the nervous system becomes hyperactive, overreacting to normal sensations. What you can do, treatment options. So, what can you do if you're dealing with physical pain that might have mental roots? Here are proven strategies that help both mind and body. 1. Therapy, especially cognitive behavioral therapy, CBT. 2. Mindfulness and meditation, lower stress and reduce pain perception. 3. Movement, gentle exercise like yoga, walking, tai chi. 4. Sleep 7 to 9 hours restores nervous system balance. 5. Social support, isolation increases pain, connection eases it. Treating your mental health isn't just good for your mood. It's good medicine for your entire body. Breaking the stigma. There's a dangerous myth out there that if pain is linked to mental health, it's not real. Let's be clear, all pain is real. It doesn't matter if it comes from a broken bone or a broken heart, your brain processes it the same way. Ignoring mental health in the treatment of physical pain is like fixing a leak without checking the pipes. The mind and body are not separate. They never were. The vicious cycle of pain and mental health. Did you know that physical pain can worsen mental health, just as mental health can trigger physical pain? It's a two-way street. 1. Chronic pain increases the risk of anxiety, depression, and even panic attacks. 2. Feeling physically limited or isolated can lead to hopelessness. 3. Mental exhaustion caused by long-term pain lowers your pain tolerance even more. Example, someone with a back injury may start avoiding social events, develop depressive thoughts, and eventually feel pain more intensely. It becomes a loop. How emotional suppression causes physical issues. We're taught to stay strong or not cry. But when emotions are buried instead of processed, they show up in the body. 1. Anger equals jaw tension, high blood pressure, migraines. 2. Sadness equals chest heaviness, fatigue, digestive problems. 3. Fear equals breathlessness, tight muscles, shaking. Nervous system dysregulation. When your nervous system is constantly in fight, flight, or freeze mode, your body forgets how to relax, even when the danger is gone. This leads to insomnia, stomach cramps, chronic fatigue, high blood pressure, and even autoimmune responses. Healing begins when we regulate our nervous system, through breathwork, grounding, therapy, or rest. Workplace burnout and physical pain, long hours, high pressure, no time to rest. That's the reality of modern work life. And it's not just exhausting, it's painful. Employees under chronic stress report more neck pain, migraines, poor posture, fatigue, and insomnia. Burnout isn't just mental, it's physical, and it's dangerous. Gender differences in mental physical pain link. Did you know that women are more likely to report physical pain linked to emotional distress? Hormonal shifts, gender roles, and emotional labor make women more prone to fibromyalgia, migraines, and autoimmune disorders. But men may underreport both pain and emotions due to societal pressure, and suffer silently. Tech, screens and mental strain. Too much time online can fry your brain, and wreck your body. Doom scrolling, screen fatigue, and social comparison lead to anxiety, depression, and poor posture. This causes eye strain, neck pain, wrist stiffness, and sleep disruption. The cost of not crying. Tears are not weakness, they're release. When we hold them in, the body holds the pain instead. Suppressing emotions like sadness or grief causes internal tension, muscle tightening, digestive problems, and headaches. Crying helps release built-up cortisol and restores emotional balance. Message: your body cries even when your eyes don't. Global mental health and pain crisis. In low-income and war-torn regions, where emotional trauma is common and therapy is rare, physical pain becomes the language of suffering. Studies from refugee populations show high rates of unexplained pain, migraines, and fatigue. In countries where mental health isn't openly discussed, pain is often the only expression of trauma. Phantom pain from the mind. Soldiers have come back from war missing a limb, but they still feel pain in that limb. This is called phantom pain. But here's what's wild. Even people with trauma but no injuries feel phantom pain in healthy body parts. The brain doesn't always need injury to feel pain, it only needs memory. It's time for a quiz, the Emotional Pain Inventory Test, Audience Challenge. Do you have constant neck pain? Stomach tightness during stress? Jaw clenching when you're angry? It's time to stop ignoring your emotional pain. Because your body isn't. The hidden pain map of the body. Guilt right pointing arrow shoulders. Grief right pointing arrow lungs, chest. Anxiety right pointing arrow stomach. Anger right pointing arrow jaw, hands. Shame right pointing arrow lower back. Use a haunting, glowing body scan to make it visually unforgettable. Your body is screaming what you won't say. Every pain has a message. Headache equals too much pressure. Throat tightness equals you're not speaking up. Gut cramps equals you're afraid something bad's coming. Message: you don't just feel emotions. You wear them. In conclusion, if you're struggling with unexplained pain, don't just treat the symptoms. Look deeper. Your mind might be asking for help. The link between mental health and physical pain is real. And once you understand it, you can start healing from the inside out. You are not imagining this. You are not alone, and you deserve real, holistic care. Right finger like, share, and subscribe if this resonated with you. And drop a comment, we'd love to hear your story.